everyone, my name is Srenithi Moorthy, and today I'm honored to present my research on a critical global health issue, brain tumors. Now, before getting into my research, a little about me. I'm a rising sophomore at Liberty High School at Frisco, Texas. I won several awards, but one to stand out would be the Early Submission Award in the Health Tech Innovators Hackathon conducted by Rezwan. Now, apart from school, I've been an active member and competitor in HOSA and a dedicated member of the orchestra community, and I aspire to continue in-depth research in neuroscience. In this presentation, we'll look at what we're dealing with, what's the impact globally, how we use AI to detect the brain tumors, my Rezwan hackathon project, and acknowledgements. Well, what is brain tumor and its impact? Brain tumors are uncontrolled cell growth in the brain. They are divided into primary tumors, which can be benign and malignant, and metastatic tumors, which are only malignant. Some common symptoms of brain tumors include seizures, nausea, vomiting, and sensory changes. When looking at the diagnosis and the prognosis, it varies based on the tumor type, grade, location, patient age, and the overall health. Early detection with MRI and CT scans can ultimately improve the effectiveness of the treatments. Treatments for brain tumors include traditional methods like surgery, radiation, and chemotherapy, but it often falls short because of high-grade tumors. Early diagnosis is crucial for effective intervention, which improves disease management and overall patient healthcare. Lastly, brain tumors have a profound global impact, affecting people of all demographics and ages. The burden extends beyond health to economic and social dimensions, with patients facing high medical costs, long-term disability, and reduced quality of life and healthcare. Families also endure emotional and financial strain. In low and middle-income countries, for example, the lack of diagnostic tools and treatment facilities leads to delayed diagnosis and poorer outcomes. Now let's compare the maps of the HDI and brain tumor incidence rates. HDI ranks countries by income, education, and life expectancy, while the brain tumor rates are influenced by healthcare access and diagnostic capabilities. It is evident from the visuals that higher HDI countries report more brain tumors due to better healthcare and diagnostics, while lower HDI countries underreport due to limited resources. Improving global healthcare equity is essential for accurate diagnosis and treatment of brain tumors, which enhances global health outcomes and better patient healthcare outcomes. When looking at the global health issue, three main factors play a major role. First up, the cost. The financial burden of brain tumor diagnosis and treatment is very significant. In high HDI countries, advanced imaging, surgery, radiation therapy, and chemotherapy can cost tons of dollars. Second up, time. Early detection is very crucial for effective brain tumor management, which requires timely diagnostic access. High HDI countries have short wait times and treatment, leading to quicker interventions. But in low HDI countries, delays due to limited infrastructure results in advanced disease stages at diagnosis, reducing treatment access. Lastly, the accessibility. Healthcare accessibility varies very widely. High HDI regions offer advanced medical facilities, while low HDI countries, especially in rural areas, often lack essential services. In Ethiopia, for example, few specialized centers exist, forcing patients to travel long distances and incur extra costs, leading to late or misdiagnosis. By understanding the factors of cost, time, and accessibility, we can advocate for more equitable healthcare solutions which can bridge the gap between high and low income countries. Now let's look at some global health statistics. Brain and other CNS tumors rank as the fifth most common form of cancer. Glioblastoma is the deadliest type of brain cancer, accounting for 45% of all primary malignant brain tumors, and the 5-year average survival is only 8%. Well, how exactly can we solve this global health issue? For the solution, we have MRI and CT images which we pass as input data to our models. These images are first pre-processed to enhance quality by reducing noise and segmenting the tumor regions. Next, we use convolutional neural networks, CNNs, to extract relevant features from these images such as tumor shape, size, and texture. In addition to imaging data, we also collect genomic data from patient samples. This genomic data is processed to identify specific genetic mutations associated with brain tumors. We then integrate the features extracted from both imaging and genomic data to form a comprehensive data set. By combining these data types, we leverage the strengths of each to improve our diagnosis accuracy. Our machine learning models are trained on this integrated dataset to learn patterns and correlations that indicate the presence of brain tumors. These models are validated using performance metrics to ensure they are accurate and reliable. Once the models are trained, we deploy them in clinical settings where they can be used to assist healthcare professionals in diagnosing brain tumors. This is very similar to my hackathon healthcare project at Regeneron, which we're going to see in the next slide. This project was built in association with Regeneron, where I built a genomic data analysis application that efficiently processes gene quantification data and generates critical visualizations. The genomic data analysis application shown in the video processes gene quantification data from RNA sequencing bioinformatics pipelines using DC2, manages large data sets, and generates critical visualizations like MA plots. Once the data files are fed into the system, it displays insights and visualizations as you can see here. Well, how can it be integrated into the current solution? Genomic analysis and insights could be fed to the machine learning models, improving prediction accuracy. Accolades include winning the early submission prize in the Health Tech Innovators Hackathon conducted by Regeneron. These are the references. And thank you so much. I thank my family, friends, and all my mentors for this immense amount of support in my research. Thank you so much. This is my contact. Please email me if you have any questions. And thank you, Johns Hopkins University, GHLC, for giving me this wonderful opportunity to present on this critical global health matter. Thank you.